Hi, this is Dr. Jack Allergy. You can follow me on my YouTube channel, Dr. Jack Allergy, DrJackAllergy, or on Twitter at hashtag Dr. Jack Allergy, spelled the same way. Today I want to talk about hives, or also known as welts, also in the medical term known as urticaria. Hives, or welts, are red, raised, and itchy. Okay? The best way to describe them is if you've had a mosquito bite, that's what hives tend to look like. Now, hives will occur in 1 out of 4 people at some point in their life. We don't know why, it just happens. Hives are like acne. They don't kill you, they just ruin your life. Hives can occur on any part of the body, any part, even in the genital region. Okay? It is not uncommon for people to experience them all over and for long periods of time. There are 2 classifications. We call them acute and chronic. Acute hives means it's 6 weeks or less. The moment it's more than 6 weeks, it's chronic. That's it. Those are our 2 classifications. Now, I think of hives kind of as the Baskin-Robbins of skin conditions because they come in 31 different flavors, all different types. But if it's not itchy, it's not a hive. Hives are red, raised, and itchy. Okay? Now, what are some possible causes? Well, unfortunately, 90 to 95% of the time, we have no idea what caused it. We don't. I'm sorry. That's just the way it is. Additionally, most times patients don't just go to the doctor the first time they get hives. They've had them for a while or they're recurrent or whatever. So I don't know is 90 to 95% of the time. Other possible causes are medications. Have you started or taken anything new? Foods. Have you tried anything new? If you've eaten the food 10, 20, 30, 40, 50 times before, it's probably not causing your hives right now. Same thing with your medications. What about, have you started anything topical? Did you travel anywhere? These are possible causes. Something that is also possible cause is your work environment. Are you working with chemicals? If you're in the janitorial or custodial industry, if you're in the beautician or cosmetology industry, if you're in construction or painting or whatever, chemicals are very irritating. And although they tend to cause more of contact dermatitis, they can cause hives by inhalation or by ingestion or by topical. A very, very common cause is infection. If you have had an upper respiratory infection, a cold, the flu, an ear infection, sinusitis, tonsillitis, urinary tract infection, pneumonia, bronchitis, it doesn't matter. If you've had an infection within the last 6 weeks, there's a possibility that's the trigger. It is one of the most common causes that I see in my kid population. Something else, stress. Stress is a huge cause for hives or welts, okay? Before pictures at school, before a dance, before prom, before weddings, very common. Before a big speech, we see it. Okay. Now, hives, I said they're acute or chronic. Now, typical hives can occur anywhere on your body, but the classic hive should not last more than 24 hours in one particular spot. So when I ask you about your hives, I'm not talking about do they ever go away? I'm asking you, if I put a circle around the hive right here, how long would it take just for that hive to go away? And I don't care if you're on medications. I want to know how long that hive is lasting. If it's less than 24 hours, and most times it is, great. That's a good thing. If it's taking longer than 24 hours, I have to start thinking outside the box. It could still be just a regular generic hive and they're lasting longer in your body, but you also need to think about possible autoimmune disease, vasculitis. Vasculitis is inflammation of the blood vessels, also precipitated by infection most commonly, but sometimes medications. Okay. I want to know, what have you taken for this since I saw you? Does anything make them better or worse? Additionally, Hives tend to get worse at nighttime. Have you ever had hives or itchy skin and you're going to bed and you're just miserable? Incredibly common. It is something that we see because the natural steroid in our body, known as cortisol, tends to be lowest at nighttime. Okay? So, hives, red, raised, and itchy, can occur on any part of the body. They come in acute or chronic flavors. All different types. If it's not itchy, it's probably not a hive. How long have you had them? What makes them better or worse? 50% of the time, you're going to get hives just by themselves. 45% of the time, you're going to get hives with sometimes swelling. The swelling tends to affect the lips, the mouth, the throat, the tongue, the nose, the eyes, the ears, the fingers, the feet, the hands, the feet, sometimes the genital region. Typically, the swelling will occur on just one particular side. People will tell me, my tongue swelled, but it was only one side. My lips swelled, but it was only the right upper. It's interesting that that's known as Angio Edema, or atypical mucosal swelling, which occurs with hives, but it tends not to cross the midline. It's very interesting. We don't know why, but it does. Angio Edema is a hive. It's just deeper. It's in the deeper layers of the skin, whereas hives are in the more upper layers. Okay, so we talked about length, acute or chronic. Interestingly, 1 in 4 people, or 25% of the population at some point in their life, will get hives, and we don't know why. Most of these people don't go to the doctor. If you are experiencing hives, see your doc. See an allergist. We're the ones who are really going to get it under control. Okay, so next video, I'm going to talk about what type of studies we can or should do, or if they're even necessary, and treatment options. So please feel free to subscribe. If you like it, please hit the like button. I think we're all jonesing for likes on our social media. Feel free to follow me on this YouTube channel, Dr. Jack Allergy. If there are questions, please put them down below in the comments section. I will try to answer them. I really will, I promise. And as my channel becomes more knowledgeable or people know about it, I will then do videos on the questions. I'll be happy to answer them. You can follow me on Twitter at #DrJackAllergy. Have a wonderful day.